Welcome to the Spanish faculty. I'm Emma, and today we're diving into Spanish for nurses, absolute beginner level. If you've ever walked into a patient's room and felt helpless because they only spoke Spanish, this lesson is for you.
And I'm Alex. We've all been there, right? You need to ask about pain levels or explain a procedure, but there's a language barrier.
Exactly. By the end of this video, you'll know how to greet patients, ask about pain, take vitals, and offer comfort, all in Spanish. Let's get started. First things first, greetings. When you enter a patient's room, you want to make them feel comfortable. Let's start with good morning.
In Spanish, that's buenos días. Say it with me. Buenos días.
Buenos días. Notice it sounds like buenos días. The U in buenos has a soft W sound.
What if it's afternoon or evening?
Great question. Good afternoon is buenas tardes. Buenas tardes. And good evening or good night is buenas noches. Buenas noches.
So buenos for morning, but buenas for afternoon and night.
Exactly. Now, after greeting them, you want to introduce yourself. Say, my name is Emma. I'm your nurse.
In Spanish, me llamo Emma. Soy su enfermera. Let's break that down.
Me llamo means I'm called or my name is. It sounds like me llamo. Then your name, then soy su enfermera.
Soy means I am, and su enfermera means your nurse. If you're a male nurse, you'd say su enfermero.
Right. Enfermera for female, enfermero for male. Let's practice the full sentence together.
Me llamo Alex. Soy su enfermero. See? Super simple.
Now, let's add one more thing. You want to ask, how are you? That's ¿cómo está?
¿Cómo está? Say it slowly. ¿Cómo está? The upside-down question mark is just for writing. You don't pronounce it.
So a full greeting might sound like, Buenos días. Me llamo Emma. Soy su enfermera. ¿Cómo está?
Let's hear that one more time slowly.
Buenos días. Me llamo Emma. Soy su enfermera. ¿Cómo está?
Perfect. That's your go-to introduction in any patient room.
Okay, now let's talk about pain. This is probably the most important thing you'll ask as a nurse.
How do you say, do you have pain in Spanish?
You say, ¿tiene dolor? It sounds like tiene dolor. Tiene means do you have, and dolor means pain.
So if I walk in and want to check on a patient, I just say, ¿tiene dolor?
Exactly. But let's get more specific. You might want to ask, where does it hurt?
Oh, that's super useful. How do you say that?
You say, ¿Dónde le duele? Say it with me. ¿Dónde le duele? ¿Dónde means where, and le duele means it hurts you.
So, ¿dónde le duele? That's easy to remember.
Now, let's say they point to their stomach. You might want to confirm, does your stomach hurt?
How do we say stomach?
El estómago. So the full sentence is ¿Le duele el estómago? That's ¿Le duele el estómago?
What about other body parts, like the head or chest?
Good thinking. Head is la cabeza. So you'd say ¿Le duele la cabeza?
And chest?
El pecho. So ¿Le duele el pecho?
This is great. Let me try a few. ¿Le duele el estómago? ¿Le duele la cabeza? ¿Le duele el pecho?
Perfect. Let's add a few more body parts quickly.
Please do.
Arm is el brazo. Leg is la pierna. Back is la espalda. And throat is la garganta.
So I could say, ¿Le duele el brazo for arm pain, or ¿Le duele la garganta for throat pain?
Exactly. Now here's a key question. On a scale of 1 to 10, how much does it hurt?
Oh, wow, that's a mouthful in English. How long is it in Spanish?
It's actually pretty straightforward. En una escala del 1 al 10, ¿cuánto le duele?
Let's break that down, please.
Sure. En una escala means on a scale, del 1 al 10 means from 1 to 10, and cuánto le duele means how much does it hurt.
So, en una escala del 1 al 10, ¿cuánto le duele?
Yes. Now, realistically, you might shorten it and just say del 1 al 10 while gesturing with your hands.
That's smart. Body language helps a lot.
Absolutely. And if they say a number like ocho, 8, you'll understand the pain level immediately. Let's move on to giving instructions. Sometimes you need patients to do simple things like breathe deeply or open their mouth.
How do you say breathe deeply?
Respire profundo. That's respire profundo. Respire means breathe, and profundo means deeply.
Respire profundo. Got it. What about open your mouth?
Abra la boca. Abra la boca. Abra means open, and la boca means the mouth.
Simple. How about close your eyes?
Cierre los ojos. That's cierre los ojos. Cierre means close, and los ojos means the eyes.
What if I need them to sit down or stand up?
Sit down is siéntese, siéntese, and stand up is levántese, levántese.
Those are longer words. Let me say them again. Siéntese, levántese.
Great. One more. Relax. That's relájese. Relájese. Very similar to English.
Relájese. I like that one. It sounds calming already.
Exactly. Now let's practice a mini scenario. Imagine you're taking someone's blood pressure.
Okay, what would I say?
First, you'd say, I'm going to take your blood pressure. That's voy a tomar su presión.
Voy a tomar su presión. What does each part mean?
Voy a means I'm going to, tomar means take, and su presión means your pressure or blood pressure.
So then I'd probably say relájese, right?
Yes, and maybe add this won't hurt. That's esto no duele.
Esto no duele. That's reassuring. Esto is this, no is no, and duele is hurts.
Exactly. So the full interaction could be voy a tomar su presión. Relájese. Esto no duele.
I love how practical this is.
All right, let's talk about yes-no questions. These are super helpful when you need quick answers.
Like asking if they're allergic to anything.
Exactly. Are you allergic to any medication? Is ¿Es alérgico a algún medicamento?
Whoa, that's long. Can you break it down?
Sure. ¿Es alérgico means are you allergic? If you're speaking to a female patient, say ¿es alérgica with an a at the end.
Got it. Gender matters in Spanish.
Yes. Then a algún medicamento means to any medication. So ¿es alérgico a algún medicamento?
What if I just want to ask if they're allergic without specifying medication?
Just say ¿es alérgico? Or ¿tiene alergias? Do you have allergies?
Tiene alergias. That's easier to remember.
Another important one. Have you eaten today? That's ¿ha comido hoy?
Ha comido hoy. Let me guess. Ha comido means have you eaten, and hoy means today.
Exactly. You're catching on fast. What about asking if they've taken their medication? Have you taken your medication? Is ¿ha tomado su medicamento?
Ha tomado su medicamento. So, ha tomado is have you taken.
Yes, and su medicamento is your medication. Let's add one more. Do you feel nauseous?
How do you say that?
¿Tiene náuseas? Náuseas means nausea.
Tiene náuseas. That's super useful in a hospital setting.
Definitely. And if they say sí, which means yes, you know they need help.
What if they say no?
Then you're good to go. Sí and no are the same in Spanish and English pronunciation ones. All right, let's talk about comforting your patients. This is where your tone and body language matter as much as the words.
How do you say everything will be okay?
Todo estará bien. Todo means everything, and estará bien means will be okay.
Todo estará bien. That's comforting already.
Here's another one. I'm here to help you. That's estoy aquí para ayudarle.
Let's break that down.
Estoy aquí means I am here. Para ayudarle means to help you.
So, estoy aquí para ayudarle. I like that.
What if you want to say, don't worry?
That's got to be super common.
It is. Don't worry is no se preocupe. No se preocupe.
No se preocupe. Could I shorten it to just no worry?
Not really. No se preocupe is the full phrase, but you can pair it with others, like no se preocupe, todo estará bien.
That's powerful. Don't worry, everything will be okay.
Exactly. One more. You're doing great. That's lo está haciendo muy bien.
Lo está haciendo muy bien. What does each part mean?
Lo está haciendo means you are doing it, and muy bien means very well.
So if someone's struggling through a procedure, I can say that to encourage them.
Yes, or simplify it to just muy bien, very good.
Muy bien. I'll definitely use that.
Let's talk numbers. You'll need these for taking vitals, giving medication doses, or explaining room numbers.
Where do we start?
Let's do 1 through 10 first. 1 is uno, 2 is dos, 3 is tres.
Uno, dos, tres. Keep going.
4 is cuatro, 5 is cinco, 6 is seis.
Cuatro, cinco, seis. I'm following.
7 is siete, 8 is ocho, 9 is nueve, and 10 is diez.
Let me try all 10. Uno, dos, tres, cuatro, cinco, seis, siete, ocho, nueve, diez.
Perfect! Now for vitals, you might need bigger numbers. Let's say someone's blood pressure is 120 over 80.
How do you say 120?
120. Ciento means 100 and 20 means 20.
And 80.
80. So you'd say 120 sobre 80.
Sobre means over.
Exactly. So the full phrase is su presión es 120 sobre 80.
Su presión es 120 sobre 80. That's your pressure is 120 over 80.
Right. Let's do heart rate. If someone's heart rate is 75, you'd say su frecuencia cardíaca es 75.
Whoa! Frecuencia cardíaca. That's heart rate?
Yes, frecuencia means frequency and cardíaca means cardiac.
And 75 is 75?
Correct. 70 is 70 and y means and, then cinco is 5.
Got it. So numbers in the tens use E to connect.
Exactly. Like 21 is 21, but 31 is 31.
This is making sense now.
Let's quickly cover time. You might need to tell a patient when to take medication or when the doctor will arrive.
How do you say, what time is it?
¿Qué hora es? ¿Qué hora es?
And if I want to say it's 3 o'clock?
Son las tres. Son las tres. Son means it is for plural hours, and las tres means 3 o'clock.
Why plural?
Because hours is plural, las horas. You'd say es la una for it's 1 o'clock because 1 is singular.
Interesting. So es la una for 1, but son las tres for 3.
Exactly. Now if you want to say at 3 o'clock, you'd say a las tres.
A las 3. So the doctor will come at 3 o'clock would be
El doctor vendrá a las 3. El doctor vendrá a las 3.
El doctor vendrá a las 3. Perfect.
One more. Take this medication every 4 hours. That's tome este medicamento cada 4 horas.
Let's break that down one more time.
Tome means take. Este medicamento is this medication. And cada 4 horas is every 4 hours.
Tome este medicamento cada 4 horas. That's super practical.
Now, let's cover emergency phrases. Hopefully you won't need these often, but they're critical to know.
How do you say I need help?
Necesito ayuda. Necesito ayuda. Necesito means I need, and ayuda means help.
Necesito ayuda. What if I want to call for help for someone else?
Say ayuda, just like in English, help. It sounds like ayuda.
Simple enough. How about call a doctor?
Llame a un doctor. Llame a un doctor. Llame means call.
Llame a un doctor. What about this is an emergency?
Esto es una emergencia. Esto es una emergencia.
Esto es una emergencia. Got it.
Here's another. Don't move. That's no se mueva. No se mueva.
No se mueva. That's important if someone's injured.
Absolutely. And if you need to say stay calm, that's manténgase tranquilo.
Manténgase tranquilo. That's a mouthful.
It is, but in an emergency, even saying tranquilo on its own can help calm someone down.
Tranquilo. Much easier.
Let's flip things around. What if the patient is answering you in Spanish? Let's cover some common responses.
That's smart. I might not always have a translator.
Right. If they say, me duele mucho, that means it hurts a lot.
Me duele mucho is it hurts me a lot.
Exactly. If they say un poco, that means a little bit.
So if I ask le duele and they say un poco, I know it's mild pain.
Yes. Another one, tengo fiebre, means I have a fever.
Tengo fiebre. Tengo is I have.
Correct. And fiebre is fever. If they say tengo frío, that's I'm cold.
Tengo frío. So frío is cold.
Yep. And tengo calor means I'm hot.
Tengo calor. These are great to recognize.
One more. No puedo dormir means I can't sleep.
No puedo dormir. No puedo is I can't.
Exactly. Puedo means I can, so no puedo is I can't. And dormir is to sleep.
This is really helpful. Even if I can't speak fluently, I can understand what they're telling me.
All right, let's put everything together with a full role play scenario. I'll be the nurse and Alex, you be the patient.
Got it. Let's do this.
Buenos días. Me llamo Emma. Soy su enfermera. ¿Cómo está?
Me duele mucho.
¿Dónde le duele?
El estómago.
En una escala del 1 al 10, ¿cuánto le duele?
8.
Ok, voy a tomar su presión. Relájese. Esto no duele.
Okay.
Su presión es 120/80. Todo está bien. ¿Es alérgico a algún medicamento?
No.
Perfecto. Voy a darle medicamento para el dolor. No se preocupe. Todo estará bien.
Gracias.
See how that flowed? Even with limited vocabulary, you can have a meaningful interaction.
That was awesome. I actually understood everything.
That's the goal. You don't need to be fluent, you just need the essentials. All right, let's quickly recap what we learned today. We covered greetings and introductions.
Buenos días. Me llamo Alex. Soy su enfermero.
We learned how to ask about pain and body parts.
¿Tiene dolor? ¿Dónde le duele? ¿Le duele el estómago?
We practiced giving commands and instructions.
Respire profundo. Abra la boca. Relájese.
We went over yes-no questions for allergies and medication.
¿Es alérgico a algún medicamento? ¿Ha comido hoy?
We practiced comforting phrases to assure patients.
Todo estará bien. Estoy aquí para ayudarle. No se preocupe.
We covered numbers and vitals.
Su presión es 120/80. Su frecuencia cardíaca es 75.
We talked about time and scheduling.
El doctor vendrá a las 3. Tome este medicamento cada 4 horas.
We went over emergency phrases.
Necesito ayuda. Esto es una emergencia. No se mueva.
And we learned to recognize common patient responses.
Me duele mucho. Tengo fiebre. No puedo dormir.
That's a lot of Spanish in just 20 minutes. Remember, practice makes progress. Even if you stumble on pronunciation, your patients will appreciate the effort.
Absolutely. And don't be afraid to use body language and gestures. They're universal.
If you found this helpful, please like, subscribe, and hit the notification bell. We have more lessons coming for healthcare professionals.
And if you want us to cover specific scenarios like pediatrics, surgery, or emergency room phrases, leave a comment below.
Thanks so much for learning with us today at the Spanish faculty. We'll see you in the next lesson.
Hasta luego.
Adios.